Hi, my name is Stephanie Colflesh. I'm a student in RHS 301 Introductory to Counseling. After watching the videos of both Carl Rogers and Fritz Perls have sessions with Gloria, I believe that Carl Rogers' theory seems to be the better choice. While watching Dr. Rogers work with Gloria, you saw her slowly become comfortable and start to speak freely about the issues that were bothering her. With some gentle prompting, you could start to see her demeanor change and her point of view change with it. As Rogers once said, we behave as we do because of the way we perceive our situation. As no one else can know how we perceive, we are the best experts on ourselves. This is from the website simplypsychology.org. In using this type of therapy, the goal is to guide the patient towards developing a deeper sense of self-awareness, rather than the therapist's views and feelings being upfront and present. In an article, The Process of Therapy from 1940, Rogers wrote, "There must be a warmth of relationship between counselor and counselee if any progress is going to be made." We see this from the very beginning of the video. Dr. Rogers greets Gloria friendly, which she points out. She says because of him talking in a low voice, she does not feel that he will be harsh on her, and because of this, she feels more comfortable talking. Later in the video, we see Gloria prompt Rogers for an answer for her problems, and although he gives her gentle encouragement using paraphrasing, summarizing, and restatements, he does not give her the answer she's looking for. He, although, helps her work through some of her feelings of confusion and guilt, which helps her feel better. Towards the end of the video, you hear Gloria say that she feels relieved. She says that even though he is not telling her what she should do, he is helping her figure out what she wants to do. In doing this, she feels that he is supporting her. Gloria then starts to talk about her feelings about her father, which are painful for her. And although she realizes that what she is asking is not something that has an answer, she understands this and realizes it is why she likes to talk to other respectable men. Although they end the video shortly after this realization, you can see the progress that Dr. Rogers has made. Next, we go to the video of Gloria and Dr. Perls. The Getzoff therapy works by engaging in a dialogue rather than manipulating the patient towards some therapeutic goal. During this type of therapy sessions, the therapist says what he or she really means and encourages the patient to do the same. It is a truly authentic and open dialogue. Although this type of therapy works for others, it does not seem to have the desired effect on Gloria. When she does her session with Dr. Perls, you can see from the very beginning that she does not have the same comfortability as she did with Dr. Rogers. From the moment she first sits down, she openly states that she is scared. Dr. Perls then starts to question her. When Gloria makes a comment that she's having the same feelings she had as a little girl, he repeatedly asks her, "Are you a little girl?" And although Gloria is trying to express a memory she had of her childhood, Dr. Girls continues to interrupt and ask her until she answers. After saying that she is not a little girl, from there Dr. Perls asks how old she is. Gloria tells him that she is 30. He then asks if she as an adult is afraid of a guy like him. Although she responds that she is unsure if she's afraid of him, she admits to feeling defensive around him. She also admits that this makes her feel dumb and stupid. After Dr. Perls comments on the fact that Gloria is shaking her foot again, she gets defensive, but smiles and laughs. Dr. Perls then tells Gloria that she is being phony. This upsets her very much. She admits that she smiles and laughs when she is embarrassed. Gloria's body language during this video says a lot about how she is feeling. Her chain smoking and hand movements seem to make her seem upset and angry. During the session, Dr. Perls has her do a role-playing exercise where she pretends to be him and says what she thinks he is feeling. She then expresses her frustration on how she feels the session is going and how his detachment makes her feel. She expresses many different feelings and thoughts in this moment, and although this does not seem to make her feel better, she continues to share. Therapists that do this type of therapy try to help people recognize that too often people allow the past to have power over their present moment. This therapy is meant to help people live in the right now. In doing this project, I came to realize that there are a lot more types of helping therapies out there than I had known. one of my favorite being Dr. Rogers. Although there are many different styles and types, they all have the same goal: